Hello and welcome to The Explainer. Today, we're diving into a topic that affects millions of people, but is often, deeply misunderstood. It's a condition that's way more serious than its common name, bed sore, might make you think. We are talking about pressure injuries, what they are, and, most importantly, what we can do to prevent them.
So, let's start with a number. Just look at that for a second. 2.5 million. It's a huge figure, and it points to a massive, often silent challenge in healthcare. But what exactly does it represent?
That's right. 2.5 million people in the U.S. alone develop a pressure injury every single year. And we're not just talking about a simple rash here. These injuries can lead to absolutely devastating complications. We're talking sepsis, kidney failure, and even bone infections like osteomyelitis. It's incredibly serious.
So, that really gets to the heart of what we're doing today. What is this thing, really? And how can we stop it? In this explainer, we're going to break down the science behind it and give you a clear, actionable playbook for prevention. Okay, so let's get into it. You can't prevent something if you don't really understand it, right? So what is a pressure injury? What are the forces that are actually causing this damage to happen?
So, at its most basic level, a pressure injury happens when a part of the body, usually right over a bone like your tailbone, your hip, or a heel, gets squeezed between that bone and an outside surface, like a bed or a wheelchair, for way too long. That constant pressure literally chokes off the blood flow, starving the tissue of oxygen and causing the cells to die.
And to really get what's going on, you have to understand two different, very destructive forces. First, there's friction. That's pretty easy to picture. It's like a rug burn you get from being pulled across bed sheets. But then there's shear, and shear is the real hidden danger here. Picture this. Someone is propped up in bed and they start to slide down. Their skin might kind of stick to the sheet, but their bones and the deep tissue inside are all sliding downwards. This pulls everything in opposite directions, twisting and kinking all those tiny, delicate blood vessels under the skin. That's shear, and it's nasty.
So how does it start? It begins with a really critical warning sign we call a stage 1. At this point, the skin is still totally intact, but you'll see a red spot that, and this is key, doesn't turn white when you press on it. That lack of blanching is a huge red flag. It's telling you that blood flow is already in trouble. It's the first alarm bell.
Now, if that pressure keeps up, the damage escalates to a stage 2. This is where the top layer of skin actually breaks open. It might look like a blister that's popped or a shallow little crater. The body's most important protective barrier, the skin, has been breached.
From there, things can get much worse, fast. In a stage 3, the injury has literally eaten through the top layers of skin and is now deep down in the fatty tissue underneath. You can see a deep crater, and even though you can't see muscle or bone yet, the damage is severe and it's a whole lot harder to heal. And that brings us to the most severe stage, stage 4. This is a wound that has gone all the way down. We're talking exposed muscle, tendon, or even bone. At this point, the risk of a life-threatening systemic infection is just sky high.
So who is most vulnerable to this? Well, the number one risk factor is, of course, not being able to move around much. But it's rarely just one thing. It's often a perfect storm of factors. Things like poor nutrition, skin that's become fragile with age, too much moisture, and other medical conditions like diabetes that mess with circulation and sensation.
Okay, so we've seen the problem, and it's a serious one. But here's the good news. Pressure injuries are, in most cases, highly preventable. So now, let's get into the solution. Let's open up the prevention playbook.
All the best clinical guidelines out there can really be boiled down to 3 simple core strategies. I want you to think of it like a 3-legged stool that keeps everything stable. You have to reduce pressure, you have to preserve the skin's integrity, and you have to improve the body's own pressure tolerance.
All right, step 1, reduce pressure. This is the absolute cornerstone. The gold standard is turning and repositioning someone at least every 2 hours. And notice that detail about the bed. Keeping the head below 30 degrees is huge for preventing that dangerous shear force we talked about. And please, this is so important. Avoid those donut-shaped pillows. It seems like a good idea, but they can actually concentrate pressure around the hole and make the damage even worse.
Next up, we have to treat the skin like the amazing vital organ it is. That means keeping it clean and dry, patting gently instead of rubbing, and using moisturizers to keep it strong. And this next point is absolutely critical. It's a reversal of some old advice. Never, ever massage a reddened area. We used to think it helps circulation, but we now know it can actually cause even more damage to those fragile, tiny blood vessels.
And finally, prevention is an inside job too. Skin that is well hydrated and well nourished is just tougher and more resilient.
Protein is especially key here. It's the building block for all tissue repair. This step is all about making the body as strong as possible to fight back against pressure from the inside out.
But, let's be realistic. What happens if an injury does occur, despite our best efforts? Well, the focus then has to shift from prevention to healing. And there's a whole science to that as well.
A wound simply can't heal if it's full of dead tissue. That material, which we call necrotic tissue, is literally a roadblock to new cell growth. Not to mention, it's a breeding ground for infection. So a critical step in healing is a process called debridement, which is just the medical term for cleaning all of that dead stuff out.
Now, debridement isn't just one single thing. It's actually a whole spectrum of techniques. It can range from something very gentle, like autolytic debridement, which uses the body's own enzymes under a special dressing to dissolve dead tissue, all the way to sharp, surgical debridement, where a doctor or nurse physically cuts the tissue away. The right tool for the job always depends on the wound itself.
So, as we start to bring all of this together, what's the one thing that connects all these strategies? Is it some fancy new technology or a miracle cream? Nope. It's actually something much more fundamental, much more human.
I love this quote. It comes from a project at a VA hospital that had huge success in reducing their pressure injury rates. And it just gets right to the heart of it. The secret weapon wasn't some brand new invention. It was about consistently and mindfully applying the simple techniques we already know work. It was about paying attention. At the end of the day, prevention isn't about one grand gesture. It's about the sum total of dozens of small, consistent, mindful actions. So I'll leave you with this to think about. What's one small thing? Checking someone's heels, offering a glass of water, just adjusting a pillow, that you can start doing consistently today to make a real difference. Thanks for joining us on The Explainer.